Hello, and welcome back to another encouraging, inspiring, and including episode of the Achieving Unity Leadership System. It is a weekly podcast, a dialogue where we can help turn complexity into execution, chaos into connection, and our purposes into action. I am your host, Mark Entrekin, founder of the Achieving Unity Leadership System, available at www.achievingunity.com, which is dedicated to all leaders, personally and professionally, to improving their lives, their family life, and their business life. We must remember that unity is not a soft skill. It is a leadership discipline because unity, like leadership, is not emotional. It is intentional. Today, I have the privilege of welcoming Dr. Thaint Naing to the Achieving Unity Leadership System podcast. What if preparing for our future health begins with understanding more today? During National Wellness Month, I am pleased to welcome Dr. Thaint Naing. We will explore regenerative medicine, stem cell therapy, and emerging approaches to wellness. I invite you to listen, ask questions, and consider how greater knowledge can help us make informed choices for ourselves and those we care about. But first, before we dive into this insightful dialogue, let me briefly introduce my company, Reality Focused Dynamics, where it all began. As you can see on the first screen, I talk about real conversations for leaders that are navigating division, frustration, and change. And remember, change is only the first step before you can improve. Improvement happens after you start that change rolling. Why is it that leadership anymore feels harder than it should? Too many times disconnection is growing. Frustration is draining people. It's draining teams. It's draining families, draining couples. Good intentions today are colliding with real world pressure. Remember, again, something I want to think about every day. Being nice, being caring, unity is not a soft skill. It is a leadership strategy. We must work together to achieve our goals. Our connection may be going kind of slow today because our screen changes aren't working quite as rapidly. Renee, you there? There it goes. Love technology. What do we mean by achieving unity? It's encouraging progress without enabling dysfunction. We have a lot of dysfunction in this world. Things don't work. Communication is not clear. Encouraging progress is what we need to do, what we must do without enabling dysfunction. We must inspire action without forcing agreement. A lot of times we see people in meetings, they're nodding their heads. Well, do they understand? Do they have the clarity they need? What we have to do is include voices while continuing to maintain that accountability. Not just the nodding of the head, the understanding of what's being said. We must continue building better businesses, better lives, and a better world, one conversation at a time. Yes, I'm your host, Mark Entrekin. I'm the founder of Reality Focused Dynamics and Achieving Unity Leadership System. I work with leaders, teams, and families, including couples, navigating conflict, navigating change, and going through complexity. I help them move forward toward clarity, unity, and sustainable action. What I'll talk about in a second is focused, where we facilitate on clear, unified, sustainable execution and delivery. Because if we are not focused, where are we? So what I've done is I've created an acronym for the word focused. FOCUSED. The F stands for facilitate, or if it's an action word, it's facilitating. We're facilitating tough conversations that build trust. It's about being truthful, not rude, but truthful. About doing that on common ground for us to have a shared purpose in what we do going forward. It's about us being clear, clear in our communication, clear in our agreements that we both know what the agreement's all about. It's about being unified. Unified is action across our differences. We have so many prejudices out there. Let's rid ourselves of those prejudices and work together across all differences. We must be sustainable. We want results that last, results that will carry us forward for execution. That execution must be consistent, responsible action. As we grow forward, we then can allow the delivery, which is inspired growth and lasting change. That's what focused is all about. That's how you can reach me. 303 focused, 303 362 8733. What can we do with that? Well, contact me. As you do, we'll be able to promote clear, unified, sustainable action starting now. Reach out to me to explore coaching, courses, workshops, or have me in a speaking engagement to help promote unity leadership in your company, your corporation, your university. We want to be able to achieve unity as the path to stronger relationships. We want that inspired leadership, and we want lasting change. In today's world of uncertainty, unity is no longer a luxury. It is a necessity. Again, this is a weekly podcast. Come back each and every week, put it on your calendar. We have an excellent guest today that's going to talk about getting ready for tomorrow. Next week, we'll have Daniel Aaron here talking about spiritual leadership. On the 26th of August, we're going to have Sharon Ray here talking about mental wellness, routines, and structure that we can work with each and every day going forward. Then on September 2nd, we will have Dr. Mort Orman, who is also my first guest. My podcast started 100 podcasts ago. This will be 101 conversations later, talking about self-improvement, life mastery, and ending unwanted anger. And that's on September 2nd. Put that on your calendar too. And then we're going to have Maria Press come back. She's been here before, but she's going to talk about the masculinity, femininity issues that we have today. Masculinity and femininity, what are those issues that we're having today? And what are your questions about those and how we can address those going forward? Please put us on your calendar. The best way to do that, take a picture of this screen. This is my QR code. And yes, I'm your host. And take a picture, put it online, go to your laptop, your iPad, bring up my site. Let's communicate. Connect with me. Get on my email list, my newsletter. Let's continue our communication. And now I have to say, because of the state of Florida, one thing that I have to do today is to talk about the required disclosure for Florida. Because what we want to do is make sure that we follow Florida law and FDA guidelines. Dr. Nye performs one or more stem cell therapies that are not yet approved by the U.S. Food and Drug Administration. This podcast itself is for educational and informational purposes, and that's all it does and does not constitute medical advice. Listeners are encouraged to consult their own qualified healthcare provider before pursuing any medical treatment. So what that's telling us then, some of the things that we're talking about today may not be approved by the FDA, but don't forget how many years ago that people couldn't run a 4-minute mile. But once that happened back in May of 1954, many people have run a 4-minute mile. Even over 25 high schoolers have done that. So the information we're taking care of today Make sure you realize it's educational, but it's going to be part of what we see for tomorrow. Now, this is another picture I'd love you to take. This is to learn more about Dr. Thaint Naing. On the left, you'll see the QR code for her quantumcellulartherapy.com. On the right, you'll see the QR code for her email address. So please take a picture of this slide, get in touch with her. Have more questions going forward? Please contact her. Let her know. She'd love to talk with you. Excuse me. So our guest today, and I am so excited to welcome Dr. Thaint Naing, an internal medicine physician and regeneration medicine consultant who explores innovative approaches to healthcare, recovery, and our own body's natural healing process. Through her work in regenerative medicine and personalized medical consultation, Dr. Naing helps individuals better understand emerging therapies, including stem cell treatments, while emphasizing patient education and informed decision making. Her insights offer a thoughtful look at the possibilities and the future of personalized approaches to healing and wellness. Would you please help me welcome Dr. Thaint Naing.
Thank you,
Dr.
Mark.
Naing, how are you?
Doing great. Yeah, nice
So
to
good
see
to
you.
see you. You bring so many interesting subjects forward to us. So if you don't mind, introduce yourself for a minute. Tell us a little bit more about what you're doing and what your goals may be for the rest of this year.
Sure, Mark. Yeah, thank you for inviting me here. So, I started out with internal medicine training and I graduated with preventive medicine. After that, I seeked out to further, alternative modalities, which include the regenerative medicine. So, yeah, throughout the training, that I was trained mainly for the hospital medicine, and then something made me really want to jump into more of a preventative care. How can we address the disease before it even arises, or patients with disease, how can we prevent to uh, prevent the farther decline, right? All these things that made me really interested in these alternative modalities, which were not included in the medical curriculum. So I was lucky enough to discover regenerative medicine plus other modalities and was able to explore farther, and incorporate and started out in anti-aging medicine incorporated with nutritional therapy. So now here I am having my own practice. Uh, I offer regenerative modalities as well as lifestyle modification, stress relief, energy medicine, neurological repatterning. So that's what I do.
That is excellent. I love so much about what you do, but there's so much that, I started college in chemical engineering, switched over to computers, computer science, business information systems. I got my master's in organizational management, but out of all that education, I know very little about, but I'm very excited about what you do. So when we look at something like a stem cell, as I understand it, it's like the body's master repair cell, and it can become many different types of tissue. It could heal damage. Am I on the right track, or what does it do?
Great, great. Yeah. So stem cells are the cell that we originated from, right? The stem is like an origin, right? So we all develop from those precursor cells called stem cells. That's how we become an embryo and fetus, and we develop all the tissues. So because of that theory, the scientists were able to figure out that okay, the birth tissue, that we became human from, and we are going rather than just discarding into in trash can, and what can we do about it? And they somehow figured that out, that these are cells that came from the birth tissue, right? Like placenta, umbilical cord, and the fluid can be utilized to treat starting with joint orthopedic conditions, chronic cartilage damage, degenerative, right? All our joints are considered like degenerative because as we age, they start to show up the symptoms. So they are one of the most common degenerative disease. And not only we can get those stem cells from these umbilical cord and birth tissue, we still store stem cells. We have in our bone marrow, majority in our bone marrow and our belly fat. And the fat we have around our waist. So they are the most
Yes.
common cells. We can use it
But
too.
let's don't talk about the fat around the waist, though, okay?
Mm-hmm.
But go ahead, please.
Okay. For sure. So these cells are here. We are carrying the stem cells that we can use at some point in our life. But as we age, the stem cell also have to endure all the life circumstances we have gone through, the environmental exposure we have had. So they have gone through certain stress signal. So that's one of the
Wow.
reason now the stem cell, in terms of stem cell therapy, you can either use it, but the birth tissue stem cell becoming more and more popular because of their potency. They haven't gone through certain stress signals in life because they're as young as day one, as young as the baby. So that's how you can get two different categories of stem cell. You want a really young one. Sometimes you can use your own stem cell. Like optimal age is 20 to 30.
Okay.
Yeah, then older than that, sometimes it works, sometimes it's not so much. Yeah.
Okay, so what you're saying, if I cut onto part of that, we can use stem cells from times when we're 20 to
Yeah.
30 years old to help us as we age a little bit?
Yeah, good question. So I would like to reframe how we um, introduce stem cells. Uh, so we cannot say that stem cells is going to help with this, help with that. Why? Because it has not been FDA approved. So we don't have enough clinical trials to make a claim. So if what I said before, if it sounds like a claim, I'm going to recorrect now, right? So the stem cell and regenerative therapies are the delivery of naturally occurring growth hormones, growth factors, sorry, not growth hormone, growth factors, regenerative cell signaling molecules, and cytokines. So cell secretions, right? Stem cell therapies are the delivery of cell secretions that fill in the gap of what our body utilizing. So our body, whenever we have a damage or degenerative disease, the body started to produce the inflammatory signals, and then the six to repair, like the seed cytokines and the growth factors and signaling molecules. So our body already have it. So then why are we utilizing the stem cell? Because it's as a support, it is to replenish. Sometimes we don't have enough signals. So stem cells are mainly cell signaling support. They will bring up and they will deliver the support our body already utilizing. So that way, please don't confuse with stem cells gonna regenerate your organ. No, your body is already working. Stem cells can make it even more abundant, right? The signals become more abundant and replenish what is missing.
That is so interesting. All right, now you're also talking about regenerative medicine, treatments that help your body itself repair and rebuild itself rather than just managing the symptoms with medication or something else. What you're doing is going to help us regenerate.
Correct, correct. Yeah. So our body always constantly fighting, constantly trying to heal, constantly trying to get back to normal. This is what an intelligent structure we have, right? Intelligent design. But that constant repair mechanism is also at the same time being threatened by all the like environmental aging, including aging, inflammation, all that. So that's why we try our best to facilitate, to reinforce the repair signals already going on. And the stem cell regenerative therapies are the main players are, and I cannot think of anything more than replenishing the cell signal other than regenerative therapies.
That is so interesting. And one of the things I love about it is that we can do a lot with our own health through this. So help me out with a word here. Exomes, exosomes. Is that
Yeah.
the tiny
Yes,
messenger particle released by the cells that
exactly.
carry healing signals to damaged areas of the body? Do I have that right?
Correct, correct, correct. Yeah, exosomes are also another popular term, right? Following stem cells. So exosomes are produced by the stem cells. Exosomes are produced by the cells. So our cells are producing all the time as well. So exosomes are messengers because they have RNAs. They will carry information. So to repair the cells, our body constantly producing those repair signals to produce more proteins, more growth factors, cytokines, signaling factors. So they carry this information and go to these area that is damaged. And when they receive those information, the cell, these damaged area will start to produce more factors that are necessary. So they work like messengers and they work like mediators. So that's why the regenerative therapy is now there are three components. Initially, we used to say only two, right? So stem cell is one component, exosome is second component. The other thing is the signaling factor. So signaling factors, we call it proteomic or just easily signaling factor that constitute a lot of different things. Growth factor, cytokines, what I have talked about. It's a hundreds of spectrum of signaling factors, especially when you get it from birth tissue, you will get hundreds of signaling factors that support how we become human. So these three components will work together. So the best way to they work together, then we usually administer them together.
That's impressive. It's so amazing to us that know so little about it, that what you put together. And I know it has taken years, and as you mentioned, there's some things that aren't approved right at this time, or yet, as the term goes, because we haven't had enough clinical trials. But what you're touching on is so important. Now, there's also one I heard of is called the PRP, platelet-rich plasma, which is our own blood, and then it's spun to concentrate the growth factors within our blood and injected back into us to speed healing in injured areas. So we're taking
Correct.
our own blood and using it to help ourselves. Is that what
Oh,
this
that's
is
correct.
doing?
Yeah, that's correct. So, like I mentioned, we have all the signaling factors, to repair the damaged area our body is producing. So, and one of the place you can find is our blood. So, in our blood, even the platelet is there not just for the blood clot, right? In the past, we used to know platelets function just to clot the blood if you are bleeding. No, the platelet have the ability to repair, mediate and reverse, go to the damaged areas and help with the inflammation. That's what they're doing. So
Wow.
if we have any joint problem, what can we do? We'll just draw some of our blood, like maybe 40 cc or something like that, and then spin it in a centrifuge. If you give a certain frequency, you will get a part of the blood that's only platelet. It's gonna
Okay.
sediment. So we will uh, take that part of the blood, usually yellow, orange color, and inject it into the joints, or even people use it for the face, for the hair regeneration, for reproductive health. Because usually a lot of our aging problems come with inflammation. You can separate aging and inflammation. So that's one of the reasons PRP can help with aging symptoms, including skin, hair, and joint inflammation, injuries, etc.
Every time that you start talking about some of these things, it's probably a big wow to a lot of us because of what you have in your knowledge and what you can do with it. So then, if you don't mind, peptides, short protein change, and you talk about they signal the body to perform specific healing functions like repair, growth, or maybe even immune support. How does that work?
Yeah, so peptides are short protein chains. Again, as our body constantly producing repair signals, right? All the most of the signals are protein. They are protein in structure. So the protein started with those small protein chains, amino some amount of amino acid put together become peptide. So peptide is smaller protein structure. So there are multiple different types of peptides in our body. We can get it from our gastric stomach mucosa. We can get it from, blood or like nerve tissue, all the different peptides we discover. So that can be simulated in the laboratory. So that was successfully simulated for decades, right? So the peptide has been utilized at different levels in different areas across US and across the world. And they have seen great success with that as well because they are very small and they can travel down to the deeper tissue. If you inject into your skin, even the subcutaneous tissue under the skin, into the
Right.
muscle, they travel down through the little veins and they can go into those inflamed areas and do some help with some inflammation because you see that in the clinical symptoms being improved after using that. So this they help facilitate the cell signaling support we use in regenerative medicine, and peptides also we use alongside with stem cell and regenerative therapy because they also give a different part of cell signaling by replenishing these small peptides that our body might not be able to synthesize constantly.
Again, it's amazing, and I'm it's so interesting to find out more about what we can do for ourselves. There's so much conflict with insurance and medicine and medical, and we don't want to get that into that today, but just what you're doing with the stem cells is so interesting. Now, another one, I just want to go, there are three more here, then we'll talk more about practices, but just some of the terminology that we see that's sometimes a little bit more normal. One is a cellular resonance quantum healing, like an energy-based therapy that works with the body's own frequencies, help restore balance and to stimulate healing.
Yes, good question. Yeah. So, one of the modality I discovered during my research phase, right, during my evolution phase after my residency, along with multiple like different technologies. I'm so impressed by all the technologies. You have how all the devices, the machines, and all that, right? And
Right.
alongside with that, the one of the technique that I discover, which I experience myself, I'm the living witness. So I used to suffer from chronic migraine. I think my chronic condition also made me want to look farther, beyond the medicine because there is no treatment for migraine. I either have to constantly take the pill to make myself feel good, or they call it preventative. But I don't believe in that, constant dependence on that particular medicine to just prevent me and make me drowsy all day. So, and I was constantly looking for that migraine treatment. And I was reading the relationship between suppressed emotions, trauma, uh, thought patterns, right? Whenever you have stress, we have
Okay.
negative thoughts patterns we kind of store in our nervous system. So I was reading about that, and one day, and unexpectedly, someone in my vicinity mentioned about that particular practitioner who helped him relieve his grief of losing his mother. So I immediately realized, I think that's what I need. I think that's what I'm looking for. Give me his number, and that's how I started. I was a patient and I was able to attend the first class, after I got a lot much better, almost cure, I would say, right? I was able to get rid of the constant gnawing sensation in my brain coming almost every day. So that
Wow.
limited my life tremendously, and that was lifted off. So I believe that I believe this is gonna work, and I believe this is gonna help my patient. So I learned this technique. I started utilizing this technique since I started my business, even a little bit before I
Right.
started my own practice. So I incorporate this neurological read patterning technique, which helps patients release the suppressed emotions, negative thoughts, belief system that came out of the stress and injuries and traumas. These are also energetically, believe it or not, these are also energetically stored in your organ systems, right? Your joint condition has correlation with the internal organ that have been not functioning optimally because of the stress you had at some point. The brain was constantly discharging disrupted signals. So the disrupted signals are interfering these energy patterns in the organ systems and ultimately affecting the joints and external structure as well. That's why when patients go to retreat, they look younger, they look happier. That's the same phenomenon. So there is something with releasing the stress, the internal, deep internal stress, outside of the nervous system and the organ system. um, mm, Presumably they change, right? So how can I do really?
Okay.
Did I do all the molecular level study? I wasn't able to. But the clinical symptoms is telling something that this stress release is helping the organs rewire to a better function. They improve. That's how even their knee pains and joint pains, I utilize regenerative. Sometimes the regenerative is not enough. Okay, not enough. If you consider the human body as both physical, mental, right, emotional,
Hmm.
all intertwined
Right.
together, regenerate some of the condition regenerative alone is not enough. So I was happy to be able to incorporate this regenerative physical treatment. I also help with lifestyle things as nutritional guidance, supplement, all that. On top of that, for particular patient, I will go deeper that you need to address your emotional stress, and I can help you with that. This is the technique.
I'm probably going to say wow 100 times on this phone call because this a
Mhm.
lot of this is amazing. And one of the next ones, I've had some family situation with. I had a brother that had low iron.
Mm.
And next question I have is what's called the IV therapy. Nutrients, vitamins, or other healing compounds that are delivered directly into the bloodstream, and it gives us faster, more complete absorption. Now, this situation, he was in a hospital for 8 days, but with this IV therapy, I'm assuming that that helped him recover.
Oh, good, right. Yeah, so IV therapies are, as you mentioned, the nutrients are delivered directly into the bloodstream. When you take it orally, it has to go through the liver, absorption and liver filter out, all that. Sometimes our gut has poor absorption too. Again, because of the microbiome, our microbiomes are usually not optimal because of the pesticide, radiation, all that. So whenever you take the oral nutrients, usually only a tiny portion is absorbed. So when the
Oh,
patient, have iron deficiency is a very good example. You give directly into the IV, and that goes quickly to the cells.
that's excellent. That's good to know and good to hear because I do walk, 5 days a week, 2 miles a day. I do my exercise. I work out 3 times a week, and I take my multivitamin. And I
Uh-huh.
never know, again, talk about FDA approval. It's not necessarily FDA approved, but it helps us going forward. And
Yeah.
it's one of those things that it's good to learn about these things for each of us. And I hope more and more people are on the call today or will listen to this recording. I have one last terminology, though, I'd like to talk with you about because it's something that I'm very strong on. That's called root cause. And I'm very big on reality. So, root cause medicine is finding and treating the underlying reason for a condition rather than only relieving the symptoms. Can you tell us more about that? Root cause medicine?
Yeah, yeah. Very good question. So the term root cause have been utilized by multiple fields. Functional medicine also utilize the root cause, the term a lot, because functional medicine also like go deeper than our traditional conventional medicine. So conventional medicine, if you look at the conventional medicine, there are medications for the hypertension, right? Blood pressure, medications for diabetes, and then to help with the glucose going into the cells, so things like that. But if you look at those medications, they did not say that how do the diabetes develop? Like let's go to the origin. No. And they have to keep taking this medication. So if you have to keep continue taking that, which means you haven't seen the root cause, right? If you see the root cause, why do you have to keep taking it? So that's where this comes from. So functional medicine go a little deeper. In terms of functional medicine will address like, okay, you have diabetes, you have high blood pressure, but I think your gut has issues, right? You never address your microbiomes, right? Microbiomes, the good bacteria in your gut. So let's address the gut health. So functional medicine go a lot deeper, right? Deeper. So they can also claim it's a root cause sometimes. For me, my root cause is deeper. So although like we can, address that, okay, let's address this gut issue and let's address this hormone imbalance. Let's, give the hormone treatment. My root cause is why my gut the microbiomes messed up, right? The environmental factors, of course, there is environmental factors, but even if we live in the same environment, why my problem and your problem not the same? There might be another root cause. So we go deeper into how we respond to the environment or how we respond to both external and internal stimuli. I think the way our brain function, the way our nervous system interact and perceive the stimulus is different. That's why even if we are given the same complete condition, we will respond differently. So I think my root cause, we go deeper towards, okay, let's address all the external, nutritional, all the things you can address, and then let's find out how your nervous system is discharging the signal in terms of repairing or in terms of aggravating the disease, even creating a disease. Um, so from a non-disease state to disease state, okay, what is the driving force from your
Right.
wellness state to disease state? So I think that's the root cause that I require, that I look for.
Impressive. I think that is so important. Okay, I want to ask another question here. Then I'm gonna, maybe you talk to us a little bit because I'm drilling you with a lot of questions here, and you're doing a great job answering them. Thank you so much. But would you say that most people today that are living today with chronic pain or fatigue or aging, as you mentioned earlier, and maybe they've been told that their only options are medication or surgery, does regenerative medicine maybe open up a third door to what we're doing today? Is it another option possibly going forward?
Yes, yeah, I believe so. I hope, right? I hope that this is gonna be fully accepted really soon so that the patients can pursue this option without the hassle of insurance not covering, the insurance covers us things FDA approved. I think that's their policy. So once FDA hasn't approved, it hasn't been nationally recognized. So they kind of for the reason they cannot approve. So patients have to go pay out of pocket, and that create a big barrier for some patients.
It does. It's a huge barrier. I just
Yeah.
am amazed at some of the things that we create ourselves. So, what are some things that you might want to talk about? I've asked you a lot of questions here.
Mhm.
What is something major that you'd like to talk about today that deals with regenerative health and stem cell therapy?
Okay,
Excuse me.
yeah. Mainly what I would like to mention is, if you yourself or people who are watching this, your family, your friends, relatives, so they might have some of the health condition they are dealing with. So once the patient themselves or their family members, start to notice the regenerative treatments, I believe, yeah, most people start to question, maybe I should tell my mom, to go and pursue this treatment because I haven't seen the success stories or something like that. So once you start to have this um, idea in your mind, I would recommend, yeah, either come talk to me or, anywhere that ask for more information so that you got better educated. And also better, it's important to talk to the right place. I also noticed, like, unfortunately, regenerative medicine have been more and more accepted, compared to past 5 years ago. In the past 2 years, because at least a few states in the United States allow the physicians to deliver there, including Florida, deliver the stem cell therapy. So what happened was also that was considered as a market to, some the business standpoint. So some of there will be some kind of clinics, that are like advertising. You might see it online, all that. So you got to be careful with who you talk to, where you want to receive those treatment, because it is important to get the safely processed umbilical cord or stem cell that came from birth tissue as safely processed cells. The cells can be expanded, right? As much as you know about the bacteria can be grown in the culture in the laboratory, our cells can be cultured the same way. However, I personally, or even for my patient, I'm not comfortable giving a culture cell to the patient. So we use only cells that are directly extracted and not cultured in the lab. When you culture, you got more numbers. So the numbers can be inflated and can be told to the patient that you're going to get this and this millions, hundreds of millions of stem cells. So now that's what is going on. I have been seeing in the market. I feel uncomfortable. Ultimately, it's the patient's decision. But however, I know that safety, know the benefits, and know there are risks. So benefit is it's a strong delivery system for cell signaling molecules that our body utilizing, and it's ready to utilize more and more and more. Risk, if the cells are not processed well, or cells that are artificially, expanded, expanded to get more numbers. And don't confuse the numbers and the quality and the function, because that's what's going on. Unfortunately, the number competition between how many hundreds of millions of cells, how many tens of millions of cells am I gonna get? So that's the most common question we get. I mentioned that we don't use culture cells. You have to look at the quality, cell potency, cell effectiveness, and knowing that how to deliver. When I mentioned stem cell exosome and signaling factors, it's all three components. Do you get all three components that effectively produce three components, or do you get those culture cells mixed up with a couple other things? So I would just say watch out for that whenever you look into stem cell therapies.
That is amazing. It's what we can do. Let me give it an example. Okay, I've got a person I care about a lot, and she just had spinal surgery. She was in Colorado and Arizona, and I think she did some uh, checking into doctors up in the North End, Minnesota area. I don't know that stem cell or regenerative therapy was ever brought up in the healing process. How do you find out more, or someone wants to find out more about that? How do we do it? Who do we call?
Yeah, so I have my own practice. You can call us.
You're
A
in Florida, right?
reputable clinic, right? So I think most doctors will say the truth, because in the right now in the market, the patients talk to a salesperson. Okay, there's a ads going on, right? Usually commercial, so you can sign up, and then there's a screening protocol. And then, okay, back pain. I would like to know about back pain. So someone will call them. So depending on which business you talk to, you might end up talking to a salesperson. Some of the salesperson, that's what I heard from the patients, right? Would like push the patient. Oh yeah, let's do it tomorrow. It's amazing. We have treated there's thousands of patients. I know where the thousands of patients come from, right? Thousands of patients with success rate is that much. Oh, stem cell, great, perfect, or the bag. Those kind of, it's a claim. So we should not make a claim, because that's not FDA approved. So we are not supposed to say that way, right? We are just supposed to educate that stem cell is the delivery system of these cell signaling molecules. Imagine your body is using it constantly using it to repair that. So we're going to give you this, deliver to your body, right? Amazing and think for yourself. But there are also studies, patients can look up, and we can also share some of the published studies. So there are those evidences. But watch out for, talk to a reputable doctor, if you get a honest answer from a doctor or some person in medical, healthcare, if they give you honest answer, then I think that's believable. And then ask for uh, or the clinic just go with those numbers, are they going to give you big numbers so that you want to come? And it's like a little marketing strategy rather than thinking the best for the patient. So watch out for those. And yeah, ask me or ask someone you can trust.
And that's a good question. I'm glad you brought that up, Dr. Na, because you talk about a reputable doctor. How many doctors know about regenerative medicine or stem cell research? It is still, it's not brand new by any means. It's been in the medical industry for decades, I'm imagining, but there's still a lot of knowledge missing. Or there's not that it's not out there somewhere, but talking about the guy who ran the mile in less than 4 minutes, there's still a lot of people that haven't, it seems like, and help me out, they haven't grasped onto the possibilities yet. So how would you find a reputable doctor? Florida sounds like the place, one place to be,
Mm.
to find out more, to be able to ask those questions. Who do we call?
Very good question, Mark. Very good question. So, I think that's why I'm here for. There are doctors like me too who practice in regenerative medicine. We are here so that the primary care doctor of the patient, or family doctor of the patient, or maybe surgeons of the patient, neurologists of the patient, they can call us because the doctors, they have their own specialty. I don't blame them. They don't have time to read about stem cell. They're doing other things, right? So that's why the best thing is the doctors, they are specialized. So they would just say, okay, I don't know much about the stem cell. So let me talk to your stem cell doctor, right? Let me talk to, or maybe I have those questions. Can your doctor answer this for me, right? Then we'll be happy to send the information. The last thing that I want to happen, for the good of the patient is the doctor they trusted, their primary care doctor, family doctor, would just easily say, stem cell FDA, not FDA approved yet. Don't do it. So, but who will be the one to suffer, right? Um, Stem cell, like I mentioned, if you are using the person who is giving the stem cell utilizing like culture cells, in a reckless manner, I totally get it. You have to really watch out for that. But if we can give quality products and we are acting also looking all the medical history to for the safety and benefit of the patient, I think just
Right.
pushing it away without investigating further can just you know what is it hinder the patient's progress or also limit their quality of life.
That's excellent to learn and to know more about that, because so many, and as you just mentioned, there's so much to it that a lot of physicians, excellent physicians, just haven't had the time yet to dig
To
into it.
Yeah.
So could you just quickly, we only have about 9 minutes left, but
Okay.
could you share which conditions or maybe which health challenges tend to respond best to regenerative therapies? And talk to us in maybe some plain everyday terms that would help us know more about it.
Oh, you're asking the condition that stems the
What hmm,
most
what
responsive to
conditions or
stem.
health challenges tend to respond best to
Okay.
regenerative
Yeah,
therapies?
very good question. Yeah, the most commonly the most common condition that stem cells are being utilized for orthopedic conditions, shoulder pain, rotator cuff tear, tendon, ligament injuries, shoulder, knee, back. So all the orthopedic mean all your joints, right? All your joints and the spine. So injuries, acute injuries, tendon injuries, acute chronic. Acute injury would respond even better than chronic. So because of that delivery of the cell signaling, support, acute injury
Right.
response matter. Chronic, the reason the chronic can be variable. The outcome can be variable because the chronic condition started to develop other things in that joint. So it's not just the damage and less repair. There are other things that develop in that. So depends on the patient, but the joint conditions are the most commonly utilized condition.
I like hearing what you're saying there too, because as you talk about it, each patient is
Mm-hmm.
different. And I
Yep.
think that's something as simple as we hear in all the TV shows and movies anymore, the DNA. But we are all different and we react differently to the different drugs. So that ability to use something such as stem cell research and what you know and can share with us, that could be possibly more natural. And I
Mm.
guess let me ask it this way, if you don't mind,
Yeah.
Dr. Nye. Would you
Yes.
say that regenerative medicine represents a shift from reactive healthcare that we seem to do so much of today, where we're treating diseases after it appears, to with what you're doing is more a proactive health, maintaining and restoring the capacity of our bodies and our abilities before the crisis occurs? Am I saying that close?
Yeah. So regenerative therapy stand for both proactive and reactive. Because as we age, our cell signaling molecules, right, cell signaling go down, the growth factor cytokines go down, and that is opening the door to diseases. So before the disease develop, we know that what drives our decline in health, right? So our decline in health came from, we're not talking about root cause. We're talking about what you see physiologically. Yeah, physiologically, you will see that our cells have a lot less functioning because they have these channels are missing. If you look at microscopy, these molecules are missing. So now you know that, oh, it could have been better if if our cells had these signals going on, right? So in that way, theoretically, if patients, would like to do proactively at certain age, when they reach certain age, they start to feel the decline in your energy, right? Decline in function. So, okay, then they can go for proactive regenerative therapies. And when they have disease, that is more of a reactive, however, reactive, but it can prevent further decline, right? Just constantly giving the signaling support. So, yeah.
What would I do myself? Is there something I can do, or is there a door I can knock on? Is there somebody I can call besides yourself? What can I do to help learn more about it and continue my knowledge to help me grow in regenerative medicine and stem cell research? And
Yeah.
how will I know what to do? Go ahead, please.
Great, great. Yeah. So we're trying to educate more and more to the people like you. So I have written a book. I haven't finalized yet, so I'm going to release it, right? So I think
Okay,
I'll post it on Amazon and multiple different, and also we are giving out to the clients who inquire about stem cell therapy. So we're going to give it out as well. We'll make it ebook, easy to download. So we'll make it available. So that's one way. Other ways, yeah, so trying to read the books and literature that are compiled by reputable doctors. There are also PubMed. If you go to PUBMED, 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 you can find there research. There are multiple research, more and more research coming out, more and more clinical trials coming up on the PubMed. These are peer review. So if you look at, yeah, you will see, some researchers are limited, some research, but more and more you get an idea of, oh, these stem cell signaling molecule have, seen this and this improvement in this amount of population. So you can get that as well. So look out for, yeah, reputable like literature and books, yeah, that's what I would say.
good. I will look for your book. I hope you'll keep me up to date on when that does get published. That's excellent. Dr. Knight, thank you so much. As we close, will you share one first step that our listeners, one, can get in touch with you? Other than what put the QR code out there, but from you, and what our listeners can take this week for what we just talked about. Tell us exactly where to find you and how to learn more.
Yeah, so you can find me on quantumcellulartherapy.com. So my clinic name is Quantum Cellular Therapies. So the website has a little different spelling, therapy.com. And then but clinic name is therapies because we offer different therapies. So I made it modern, right, plural, therapies. So and yeah, the Quantum Cellular Therapies Facebook page is also live. And on Instagram as well, you can find me. And if you go to website, my email, you can email to drthaintmd@gmail.com or my official email, qct at THAINTMD, right? QCT at thaintmd.com. When you look up, type out my name, I'm sure you will see my website and you will see my contact information.
That is great. I'm amazed just at what you do, Dr. Nye. This is so impressive and so needed for all of us to learn and to help it grow forward. I, I want to thank you from the bottom of my heart for being here, for this conversation, and for sharing your knowledge and your perspective with us today. And I think you've given us new ideas, things to consider about wellness, preparation, and our future health choices. Now we can take what we learned, ask better questions because of what you've given us today, become more informed partners in our own wellness. I sincere appreciate you helping us explore today's knowledge and can help us prepare more for a better tomorrow. But again, by Florida law, what I have to do is the information again shared today is for educational purposes only and does not constitute medical advice. Some of the therapies discussed have not been approved by the U.S. Food and Drug Administration. So please consult your own qualified healthcare provider before pursuing any medical treatment. But be able to reach out, talk to Dr. Nye, be able to talk with her and see how she can help and what you're doing going forward. Because I mentioned earlier, that Sir Roger Bannister was the first person who ran that 4-minute mile back in 1954. Many people had that opportunity. He was the first one, but since then, a lot of people have ran a 4-minute mile. I wasn't one of them, trust me. But one thing I can do is I can look into stem cell research. I can look into regenerative therapy to help me and my family. And I hope you do too. So before we close, I would love, Dr. Nye, if you could share, leave our audience with one memorable thought that they can carry with them this week. Remember talking to you, what to do going forward. What might be a closing quote that we could take from you to use going forward from today?
Yeah, so take home message is remember that your body is constantly trying to get back to normal. Yeah. So our it's not our cells and tissues, our internal design is not stopping to fight. They are constantly fighting. So our job is to support the fight, utilizing those different modalities that are harmless or or at least I would say that it has a certain safety level and to support our natural body healing mechanism that we're born with. So that's what I would say, keep that in mind and don't lose hope. I think the worst thing we can do is losing hope and thinking that, well, I have to live like that the rest of my life, right? I think that would be the worst thing. Yeah.
Thank you so much, Doctor. That is so important. There is opportunity. Don't give up.
Yeah.
Because in every conversation, one thing becomes so clear.
Mm-hmm.
Real change, improvement happens when people come together
Yeah.
in unity with purpose and when vision meets action, right?
Yes.
Hope
It's
you I hope you all took a picture of the site earlier in the podcast with Dr. Nye's QR code. If you can't get to it, if there's any kind of spelling or anything, get in touch with me. I will make sure you get in touch with her. And if not, the full podcast will be available on YouTube /at Mark Entrekin before the close of business on Friday. So be ready on Saturday morning to watch this video as you enjoy your morning beverage. Come back on here, talk to Dr. Knight, get in touch with her and find out if you have any kind of problems. She said, don't give up. Keep going. Keep building. Like I said, if you have any questions, get onto the recording. Achieving unity is what we're doing and joining with people like Dr. Nye going forward to resonate the feelings that we need and reach out and connect with me. www.achievingunity.com, www.markentrican.com, or call me at 303 Focused. Let's get focused. 303-362-8733. So thank you all for being here. Thank you, Dr. Nye, for your message, for helping us understand that the health that we build can protect and give us the freedoms that we use. It should not be the thing that's keeping us trapped personally or professionally. Dr. Nye, anything you'd like to say before we close?
No, thank you so much, Mark, and the Achieving Unity. That is very well thought, much
Thank you.
needed platform nowadays, and I'm impressed by the presentation you made, that
Thank
there's
you.
someone out there thinking about all the missing pieces, yeah, missing pieces in the world that we cannot do, only we can do together. And yeah, I really appreciate what you're doing.
Thank you so much, Dr. Nye. I appreciate you. And it was a pleasure and an honor having you today. Thank you for sharing this needed information. So, until next week, this is Mark Entrekin with the Achieving Unity Leadership System, reminding each of us that life is truly what we make it. So let's help everyone around us feel seen, heard, and supported in everyday moments, the ones that truly matter. Let's make life awesome together in unity. Hope to see you all again next week with our next step in remembering unity, us being together, is not a soft skill. It is a true leadership discipline. Till then, cheers.
Awesome.